My name is Gretchen Raffa, Vice President of Public Policy Advocacy and Organizing with Planned Parenthood of Southern New England. And first, I just want to extend such gratitude and thanks to the Governor, Governor Lamont, Lieutenant Governor Bisowitz, and the entire administration who have made it a priority to protect and expand sexual and reproductive health care. I've had the pleasure of working with the Reproductive Rights Caucus and so many legislators over my 18-year career at Planned Parenthood in Connecticut. And I just want to start with expressing gratitude on behalf of the entire advocacy community. So many of our coalition and community partners are in the room with us today. This is a group effort. We do not do anything alone in this building when we are working on policy change. And I want to just say again, thank you to our legislative champions, our administration, for taking bold action in the last 2 years to protect our health, expand our access to health care, and protect our rights and fundamental freedoms. And what I also want to just highlight and thanks is this: we are a leader. Connecticut is a proven leader. Decades of long and hard-fought battles to get to the point we are today have been won with bipartisan support, and that is something to celebrate when we are watching the attacks across this country. Since the Dobbs decision last June, the abortion access landscape has become even more fractured. We continue to face the devastating and inhumane consequences of abortion bans and restrictions on both patients' health, but the larger healthcare ecosystem. You've heard me say this before. Right now in the United States, 1 in 3 women and more trans and non-binary people have lost access to abortion in their home states because 20 states have either completely banned abortion or severely restricted it. There is no doubt that this crisis is going to continue to worsen, and we know who these bans are continuing to impact the most. Black folks, Latino, Indigenous communities, LGBTQ+ people, people living with disabilities, people with low incomes, people living in the most rural areas of our state and states across this country, and other groups who continue to face the greatest barriers to health care due to systemic racism and discriminatory policies that continue to get enacted. They will be the folks that continue to bear the brunt of these attacks. So that's why it's so urgent that we continue to fight back in our state. During this year alone, since the Dobbs decision, Planned Parenthood of Southern New England has seen a 56% increase in patients that have traveled from the 18 states that have banned abortion, and we know that number will increase since North Carolina and Nebraska have enacted their laws. And that's why the patient and provider protection laws that we've enacted over the last 2 years are so necessary in this moment. Also, as you heard from Senator Maroney, strengthening privacy and confidentiality protections for reproductive health and gender-affirming care is absolutely urgent, because we know the anti-abortion movement will stop at nothing to threaten people's lives and their health. All people, no matter who they are, should have access to their personal health care decisions, making that access to care with privacy, safety, security, and with dignity to make those health care decisions for themselves. But again, we know that the anti-abortion politicians and judges were never satisfied with just overturning Roe. This was a decades-long fight in the making, and they are continuing their fight to try to pass a nationwide abortion ban. They are coming for our birth control. Yes, they are coming for our birth control, and they are aggressively and viciously attacking trans health care, with 19 states banning or severely restricting gender-affirming care for young people. They're coming for sex education. They are coming for anything they can to control our bodies and our lives. So again, that is why the leadership that the Lamont administration, the General Assembly, the entire administration, their leadership that they are demonstrating in this moment really does make a mark on the history of our country and advancing and protecting and defending reproductive freedom. It is so critical that we keep fighting, and Planned Parenthood is committed to continuing the fight with all of the folks in the room and outside in our communities all across Connecticut until every resident in our state and those people who have to travel to our state to access essential life-saving care has the ability and the resources to control their bodies, their lives, and their futures. Thank you so much to the governor and the entire